This is Crystal Fenn with MedPage Today. Concerns about overuse of mastectomy in early breast cancer may be overblown according to a new study in the Journal of the American Medical Association. Dr. Monica Moore of Memorial Sloan Kettering Cancer Center presented the results at a press briefing.
Breast-conserving therapy consisting of lumpectomy, removal of the cancer with a margin of normal breast tissue around it, and whole breast irradiation has been directly compared to mastectomy in 6 different prospective randomized trials and been shown to result in equivalent survival. So for about the past 20 years, there have been concerns in the United States that mastectomy is overutilized. This has resulted in legislative mandates forcing surgeons to document their offering of treatment options to patients, and some institutions have chosen to use rates of breast-conserving surgery as a quality measure. In addition, we see persistent variation in the use of mastectomy across the United States, which has been cited by some as evidence of lack of patient participation in decision-making.
So the researchers surveyed nearly 2,000 women at an average of 9 months after their surgery for early-stage breast cancer.
And if we look at final surgical treatment, 67% of women underwent breast-conserving surgery only. Of those who had mastectomy, in 13%, the mastectomy was performed because of a surgeon recommendation for the procedure. In another 9%, the surgeon either recommended breast-conserving surgery or made no specific recommendation between mastectomy and breast-conserving surgery. And in another 9%, mastectomy was performed after an unsuccessful attempt at breast-conserving surgery. Most patients with early-stage breast cancer are medically eligible for breast-conserving surgery. Only 13% in this study had an initial mastectomy due to surgeon recommendations. Most patients who choose breast-conserving surgery successfully completed the procedure, although re-excision is quite common, and discordant second opinions were infrequent. So what we concluded from this study was that most surgeons in 2 large, diverse urban areas appropriately recommended surgical options for breast cancer treatment, and we did not observe differences in recommendations on the basis of race or ethnicity. From a practical point of view, what these results imply is that if we are interested in decreasing the mastectomy rate, approaches which have been advocated, such as more expensive and extensive preoperative evaluations with additional imaging modalities, such as magnetic resonance imaging, are unlikely to have an impact on the mastectomy rate because, in fact, we are quite successful at selecting patients with standard tools of physical exam and mammography. In addition, efforts to increase the use of second opinions are also unlikely to change mastectomy rates, since discordance among surgeons was uncommon, and in the small subset of patients who insisted on pursuing breast-conserving surgery after being advised not to, 50% of them ended up being converted to mastectomy.
So women reported that their surgeon recommended and attempted breast-conserving surgery in most cases, though patient preference still appeared to be a factor in mastectomy use. I'm Crystal Fenn, MedPage Today.